The drugs needed to save lives are in short supply, and it's a growing crisis in the United States. Courtney Garish spoke with a cancer patient who's still on a waiting list for a drug that could save her life.
First responders making last-minute decisions to save lives.
We need a blood pressure.
Forced to make do with the drugs available.
We just do the best we can.
Doctors looking for different options to treat cancer.
You have to come up with plan B.
And those cancer patients waiting for treatments.
There shouldn't be 200 drug shortages.
Treatments that could be the difference between living and dying.
I got to a point where I knew I was in trouble because I couldn't eat anymore.
Julie Hansen is 3 years into her diagnosis of late-stage ovarian cancer. Now on her 6th round of chemo, treating the disease has almost killed Julie.
I got a severe reaction to the carboplatin, which sent me into cardiac arrest.
So doctors switched her to a new chemo drug. It didn't work. At one point, Doxil was the preferred treatment, but it was out of supply, so Julie went on a waiting list.
How many people have died in the meantime that couldn't get the chemo they needed?
She's been on that list for 17 months.
In the meantime, every chemo has done a different damage to my body.
The drug shortage problem has skyrocketed in recent years. In 2006, 56 drugs were in short supply. In February of this year, it jumped to more than 200. Dr. Jonathan Treisman is the medical director of Wheaton Franciscan Cancer Care. He, like others, has been forced to hold off treating some patients with Doxil.
I've had patients where I really think that they would have done better had I had the drug available to them sooner.
At one point, more than half the drugs on the FDA shortage list were considered critical.
You have acute leukemia and you don't have the standard drug, that's a real problem.
First responders also in a tough spot.
Empty. Our atropine and lidocaine empty.
Life-saving drugs used on patients with heart problems, something Mike Krieger calls a huge hardship. Krieger's been a paramedic 20 years. He's now president of LifeStar EMS and has never seen anything like this.
It's just continued on and on.
Standard pain meds like morphine in short supply for several years now.
Sometimes there's alternatives and that are good. Sometimes there's alternatives that don't work quite as well.
And Krieger admits it means more room for error. Many of the drugs not available come pre-mixed.
And now we're having to potentially draw that up and dilute it and mix it up to meet what we need.
All in a moving ambulance.
Correct.
It's the United States of America, and we can't get people the treatments that they need.
Emily Roloff is with the advocacy affiliate of the American Cancer Society, one of several groups pushing to stop this disturbing trend, a trend in some cases caused by economics, manufacturers switching to drugs that bring in more money. In other cases, manufacturing problems led to plant shutdowns, disrupting the drug supply.
A solution had to happen, and it had to happen now.
And it did this summer. President Obama signed the bill into law. The hope is new legislation solves the problem. But Julie is still waiting for Doxil and is still not in remission. She's now taking a drug used to treat lung cancer.
It's like a shot in the dark. Well, let's try this.
As she waits and fights, Julie is speaking out, telling her story to anyone who will listen.
You don't want anybody to go through what you've been through.
That was Courtney Garish reporting. The new legislation requires manufacturers to give the FDA a heads up if there are issues that could lead to a drug shortage. The FDA says the number of shortages has decreased by nearly 50% in recent months.